Hello friends, welcome to my channel Biomedical Guru. This is my first video and this video is principally for those who want to learn the basics of biomedical, especially for those friends who are from non-biomedical background who want to pursue a career here, and we'll quickly jump into the topic. The topic is ECG for today, and we also call it as EKG. EKG and ECG, both of them are same. EKG is the typical European form of calling ECG, because Germans and other countries cardio they start with K, otherwise both of them are same. There is no much difference, or there is no difference at all. And why ECG is very important? The answers are very simple. ECG will show you the heart functioning based on the electrical activity. And if electrical activity, if you analyze, how will you understand whether the heart is mechanically functioning fine or not? Yes, the answer is very simple. Electrical activity will show the morphology of a heart to a greater extent. For example, electrical conductivity in heart happens only when the heart is perfect. That's the reason why ECG is the best even today when it comes to the first screening of heart. And what an ECG shows? First, an ECG will show the heart rate, typically how many beats the heart is making per minute, which is a clear cut indication of a healthy state of a human being. For very young individuals, it will be a little more. As age progresses, the heart rate will come down. The doctor will understand. And also the rhythm. Rhythm is how regularly the heart is beating. If the rhythm is, if the heart rate is normal and if the rhythm is again abnormal, that also shows an anomaly of the heart. And also sometimes when the patient undergoes something called as a cardiac arrest or something, this atrial fibrillation occurs. That is also seen in an ECG, and the doctor will immediately come to know the patient is having a heart attack. And why ECG is important for so long? It is the first science in cardiology. When we can say it is second only to stethoscope when it comes to cardiology, because we are using ECG for close to 100 years as we speak today in 2022. Because the founder of ECG got his Nobel Prize in 1924, which means ECG would have been in practice way before that. So it's probably the oldest methodology invasively to find the current condition of the heart. And also ECG is economical. In Indian scenario, ECG will start typically from 20,000 rupees, and the best ECG you can get for less than a lakh and a half. In USD, it will typically even the best of the best ECG you can get for something less than some 2,000 USD. So, which you can consider as most economical in comparison to any other modalities used in cardiology. And also a well-trained technician is sufficient to connect an ECG and get an output. You don't need a doctor on the site. Once they get the report, they can actually send it to the doctor, and the doctor can analyze and give the report. So this is another advantage of ECG, that you don't need doctor just for connecting and taking an ECG from a patient. And when it comes to ECG wave, this is what we would have learned in our biomedical school, which is ECG consists of PQRST. But this is not what you see when you see an ECG. So sometimes we need to unlearn. And what we see when we see an ECG, this is what we see when we see an ECG. And none of the leads will actually represent a typical PQRST. So do you mean to say that whatever we have learned is wrong? No. Whatever we learned is right, and this is also right, because none of the ECG leads will actually show the entire PQRST. There will be one lead, or there will be one wave or two waves missing in every waveform. That's the reason why we need so many different different waves. Each wave represents seeing the heart from one side. So PQRST is supposed to be the way the heart is functioning, but if you see from each side, it will appear in a different manner. That's the reason why, to get a holistic view of how heart is functioning, we need this many leads. Hope you got it. Yes. And again, when it comes to the acquisition, ECG, there are two types of acquisition. The basic ECG machines typically come with a 6 lead acquisition, and the high-end ECG machines come with 12 lead acquisition. So what is 6 lead acquisition and what is 12 lead acquisition? In a 6 lead acquisition, there will be 5 cables that will be connected to the patient. In a 12 lead acquisition, there will be 10 cables. The signal will be picked up from 10 points on the patient's body. So don't you think there's something missing? 6 lead ECG comes only with 5 leads and 12 lead ECG come only with 10 leads. So what happened to the remaining 2 leads in 12 lead and what happened to the remaining 1 lead in a 6 lead? So the answer is here. The gentleman who invented ECG also formulated how it is supposed to be used. His name is Einthoven, and this is called as Einthoven triangle. To see how each lead in a 6 lead ECG comes, we'll see the next image. For example, if you see here, the first lead is considering the one arm as negative and one arm as positive, which means the right arm will be considered as negative and left arm is considered as a positive. That is lead 1. And lead 2 will be right arm considered as negative and foot is considered as positive. And so on and so forth will be the third lead, in which left arm is considered to be negative and foot is considered to be positive. These are called as lead 1, 2 and 3. These are the 3 different sides from which heart is evaluated. Apart from that, there will be one small chest lead. From the chest lead, what is the means how the electrical activity is going from the chest to foot, chest to right, chest to left. They are called as augmented leads. So 3 augmented leads and 3 leads from the Einthoven triangle consist of the 6 leads in a 6 lead ECG. In a 12 lead ECG, along with the basic 6 leads, we also have 6 chest electrodes connected, that the technician will see in which intercostal space each lead to be connected, and this consists the next 6 leads of a 12 lead ECG. So what are the features of an ECG machine which are considered to be important? In a basic ECG machine, we need a printer to get the output. We need a trace selection, which is nothing but the speed of the paper. Imagine for a tachycardia or a bradycardia patient, especially for tachycardia, when the waveform appears too near, sometimes we need to see it little broader. So we need a trace selection. And again, different leads for different lead selection, we need a button for selecting different leads. And sometimes to reduce the artifacts, motion artifacts, and other electrical disturbances in the body, we need to use filter. Filter can be on and off. And also, if some leads get disconnected, the technician should understand. For that, there need to be an alarm for lead, when a lead gets disconnected, and of course, power backup, because ECG is supposed to work without power also in some scenarios. And when it comes to an advanced machine, apart from all these features, we need an interpretation and analysis. Analysis is nothing but seeing the ECG waveform, telling what is the heart rate and other parameters. And interpretation is based on the waveform, what could be the problem. That is called as interpretation. And of course, high-end ECG machines also need advanced printing options, which is like printing on A4 paper, printing on a much wider paper, and also advanced ECG machines need to have connectivity to hospital LAN or Wi-Fi, and high sampling rate. High sampling rate is nothing but the smallest possible artifact will also not be missed. And of course, high-end ECG machine also should have a very good storage where at least 100 or 200 ECGs can be stored. And that's all about the basics of ECG. We'll meet in a next topic very soon. And thank you for your attention. And if you like my content, please share it with your friends and colleagues whom you feel it will be appropriate. Take care and thank you. Bye bye, friends.